Fever during rainy season. When should you see a doctor? Have you or someone in your family developed a fever during the rainy season? Fever is one of the most common symptoms we experience, but it can be difficult to know whether it is something you can monitor at home or a reason to see a doctor. During the rainy season, several illnesses can cause fever, including viral respiratory infections, influenza, dengue, and other infections. Flooding can also increase exposure to certain infections. What is a fever? Fever is generally a temporary rise in body temperature and is often a sign that the body is responding to an infection. A fever itself is not a disease. It's a symptom. That's why it's important to look at the whole picture, not just the number on the thermometer. When can you monitor at home? If the fever is mild and the person is otherwise alert, able to drink fluids, and breathing comfortably, you can usually monitor their condition while following appropriate home care advice. Encourage adequate fluid intake. Allow the person to rest and monitor their temperature and other symptoms. If medication is needed, use only the appropriate medicine and dose recommended by a healthcare professional or according to the product instructions. When should you see a doctor? You should seek medical advice if the fever is persistent, keeps returning, becomes worse, or is accompanied by concerning symptoms. Watch for severe headache, repeated vomiting, severe abdominal pain, unusual drowsiness, confusion, significant weakness, difficulty breathing, or signs of dehydration. These symptoms should not be ignored. Think about dengue. During the rainy season, dengue is an important health concern in many areas. Dengue can cause sudden fever along with headache, body aches, pain behind the eyes, nausea, vomiting, or rash. But symptoms can overlap with other infections, so don't try to diagnose dengue based on symptoms alone. If you have a fever and possible mosquito exposure, consult a healthcare professional. Remember, warning signs can sometimes appear around the time the fever starts to improve. What about floodwater exposure? If you develop a fever after being exposed to floodwater, tell your doctor or healthcare provider. Floodwater can contain harmful organisms and may increase the risk of certain infections, including leptospirosis. Final reminder: fever is common, but it shouldn't automatically be ignored. Monitor symptoms carefully, stay hydrated, get adequate rest, and seek medical advice when symptoms are persistent, worsening, or accompanied by warning signs. This rainy season, don't just watch the thermometer, watch the symptoms. Stay alert, stay hydrated, and know when it's time to seek medical care.